Good morning, good afternoon, everyone. Thank you so much for joining us today for our webinar, Let's Talk Whiteness and Health Equity. I am Sume Ndumbe-Eyoh with the National Collaborating Center for Determinants of Health. As we get started, I just want to remind all participants that today's webinar is being recorded and will be available on the NCCDH website after the call. We're just asking that everyone keep their microphones muted and their videos off during the presentation part of it, and we will invite you to turn on your videos once we go into the discussion. The National Collaborating Center for Determinants of Health is in Mi'kmaq, which is the ancestral and unceded territory of the Mi'kmaq people. Mi'kmaq is covered by the Treaties of Peace and Friendship, which was established in 1725. I think I share this as a reminder that we are all treaty people, and also in a recognition not just of the gross inequities which continue to exist for Indigenous peoples across Turtle Island, but also acknowledging the ongoing resistance to various forces of colonization, which has been part of the history of this land. I am joined today by Nancy Laliberté and Alycia Fridkin, and I will let them introduce themselves. And as I do so, encouraging all of us to introduce ourselves in the chat box, as a number of you are doing, and also identifying where you are speaking today from. My name is Sume, as I mentioned, and I'm a Black woman from Cameroon. I've been a guest on Turtle Island for about 20 years. The bulk of that time was spent in Takaronto, Toronto, which is the traditional homelands of the Mississaugas of the Credit and other Indigenous peoples. I have been living and working in Montreal for just over a year now, and like many of the Black people in Canada, my history is entangled with various legacies of colonization, and Cameroon as a country is still living the repercussions of that. And I just want to recognize all the ancestors, Black ancestors, who found themselves in Canada and across Turtle Island through processes of slavery and other forces of colonization. And I also say this to say that the conversations we're having today are really global conversations. Anti-Blackness is a global struggle, as well as the resistance to it. Part of my own learning and commitment is really this ongoing commitment to disentangling how various colonial projects position Black and Indigenous peoples in very specific ways, and also how our communities are resistant to those distortions, and in doing so, learning how to be a good guest. I also want to remember that we are in the United Nations Decade for People of African Descent. And again, this is a global struggle. And as Ama Ata-Ida, and she's a Ghanaian writer, she says, wherever they are, and from whatever causes, my God, Black peoples, my peoples, still die so uselessly. So recognizing that these are global concerns and struggles. Nancy?
Thank you, Sume. Tansei Nito Temak, Nancy Laliberté Netsi Gasan, Nihiao and Métis from the Beaver River area of what is now known as Saskatchewan. Today, I'm happy to be calling in from the Anishinaabe Chippewas of Rama First Nation land in the Eastern Territories. And I thank you so much to the National Collaborating Center for Determinants of Health and Sume for engaging me in this interesting and ongoing educational opportunity. Hi, hi.
Hi, hi.
Thanks, everyone. Thanks, Sume and Nancy. Hi, everybody. My name is Alycia Fridkin. My pronouns are she and her. I'm a white settler with Jewish ancestry from Russia and Poland. I'm queer, and I'm here living in Vancouver on the unceded, stolen, and occupied homelands of the Musqueam, Squamish, and Tsleil-Waututh nations. And I'm really grateful to Sume and to the Collaborating Center for having us here, and to my friends Nancy and Sume. This is I'm just so grateful to be doing this work with you, and I'm really very excited about today.
Great. Thank you both so much. So Nancy, Alycia, and I have been doing this work together over the last year, and it's been a really great partnership, friendship, collaboration. We use all sorts of words to describe our work and time together. That's been a real pleasure doing this work with both of you and learning from both of you. The National Collaborating Center for Determinants of Health, as I mentioned, is hosting today's webinar, and our focus is on the social and structural determinants of health, and we do so through translating and sharing evidence and really think about evidence in a very wholesome way. And you'll see that reflected in our conversation today. We work primarily with public health practitioners, decision makers, and researchers. So really, those of you on the line today, as we do this work together. As we continue, I'd just like to ask us all to just keep our microphones muted throughout the session so that we don't have any background noise. Thank you. The NCCDH is part of a network of 6 national collaborating centers, and we are all funded by the Public Health Agency of Canada. Depending on your area of interest in public health, I encourage you to visit our colleagues. They all have really amazing resources to share. So there are NCCs focused on Indigenous health, methods and tools for evidence-informed decision-making, infectious diseases, healthy public policy, as well as environmental health. And you can reach out to any of the NCCs through the main website, nccph.ca, or by going through their own specific websites. So during our time with you today, we are going to be talking about whiteness, what it means, how it shows up at various levels, systemic, institutional, as well as individual. We're also going to be discussing how whiteness impacts health and well-being, and ending with the way forward. So what do we do with all this? How do we start to think about unsettling whiteness? So this is a fairly tall order. So as we say this, we're recognizing that these are conversations in progress. So we're starting a conversation which, for those of us for all of us in the line, is a different entry point, and really inviting whatever entry point you're coming into this conversation, that is welcome today. So for some of you, this is something which you do, you learn, you study, you research, you live. Well, we're all living it actually. And for others, maybe this is your first foray into the conversation. Wherever you are, that is completely welcome, and we'd love you to share that with us throughout. So as we continue here, we'd like to get a sense of who you are in terms of your own racial identity. We will be taking questions and using polls using Slido, and we'll drop that in the chat box. You can go to slido.com using the event code you see on your screen. And so we'll be using that throughout today for our engagement. It'll just make a few things easier in terms of being able to see the questions. So the first poll, which you'll see in a second, is, let's turn that on. The first poll you see has to do with our racial identity. So the question is, how do you self-identify? You'll see a number of options there, and you can just select. I think it'll let you select as many as are relevant for you, and you'll see the responses come in as you do so. I'm just going to see where we're at here. All right, so right now about 80% of people identifying, it's fluctuating between 70 and 80% identifying as white. We have 4% saying they're East or Southeast Asian, 5% of people are identifying as Indigenous, about 2% as Latinx. I keep scrolling down here. We have about 3% of folks saying they're Black, and the numbers are fluctuating this. So thank you all so much for sharing that. I think that this gives us a sense of who's in the part of the conversation. As we ask about our own identities, we recognize that the ways in which we self-identify and the ways in which we may be identified in the world may be quite different. In today's conversation, as Nancy, Alycia, and I speak, we'll be using different terminology. You'll hear racialized, Indigenous, Black, BIPOC, and we'll use that sometimes for ease, knowing that sometimes when we use these very broad descriptors, it actually masks a lot of the complexities of our lives. And so where we'll be specific at different points, and at some points we will go broad. The one thing I want to say is that we all have different relationships to whiteness, right? And regardless of our own unique relationship to whiteness, that we all have a role to play in this conversation in terms of how we understand whiteness as a system and how we disrupt it. So in a sense, like, whiteness is knowable. We can understand how it functions, which is really what our conversation today is about. So as we say this, the question Nancy, Alycia, and I have for you today is, why are you part of this conversation today? Like, in what ways do you think unsettling whiteness actually enhances your practice? If you're in research, if you're a practitioner, if you're a decision maker, if you're a student, in what ways can unsettling whiteness enhance your practice? You can drop your responses in the chat box. They would love to see those. In what ways can unsettling whiteness enhance your practice? So part of this work is really, a lot of this work really is speaking to work which we released in a recent document called Whiteness and Health Equity. Nancy, Alycia, and I worked on this document together for, I'd say, over a year or so. And throughout today's conversation, we will be discussing this. I'm going to pass it on to Alycia to get us started. As we mentioned, we'll be discussing whiteness as a phenomenon and then moving to discussing how it shows up at different levels. Alycia?